Good evening, everyone. It's great to see so many of you joining us. Say hi in the chat and let us know you're here. We welcome you all and thank you so much for joining us today. My name is Stephanie Paul and I am the Executive Director for MyFace. I'm pleased to welcome you to our program today. This web education program is designed for families of children with craniofacial differences, caregivers, and healthcare providers. I would like to thank the Louis J. and June E. K. Foundation for funding this important program and acknowledge their appreciation for the critical need to provide educational programs like this one for families of children impacted by craniofacial differences. MyFace has a long history of providing access to comprehensive medical and dental care, along with education and direct patient services, paving the way for better patient outcomes. At the heart of our approach, there are three pillars of support. First, our grant support to top-level organizations across the nation. We deliver quality, comprehensive craniofacial care to ensure that patients receive surgical, dental, psychosocial, speech, nutritional, and other aspects of coordinated care. Second, through our range of direct services, MyFace aims to meet the day-to-day needs of the craniofacial community by offering support groups for affected children and adults and parents, distribution of newborn craniofacial care kits specially designed for babies born with craniofacial differences, and housing for families who travel to New York City for treatments. Finally, we strive to educate patients, families, and healthcare providers through programs like this Transforming Lives webinar series, and raise public awareness about craniofacial difference through our Wonder program and school assemblies. And our monthly podcast, My Face, My Story, Voices from the Craniofacial Community, where individuals can share their stories, be seen, and be heard. MyFace is here to bring together the craniofacial community and help transform the lives of children and adults living with facial differences. We believe everyone deserves the chance to thrive and live the best life possible. And now to our program. Our presenters today are Dr. Jessie A. Taylor, Peter Randall Endowed Chair and Chief of the Division of Plastic and Reconstructive Oral Surgery, Co-Director of Cleft and Craniofacial Program, and Director of the University of Pennsylvania CHOP Craniofacial Fellowship Program at the Children's Hospital of Philadelphia, located in Philadelphia. Joining him will be Leanne McGee, pediatric psychologist at the Children's Hospital of Philadelphia, and assistant professor of clinical psychiatry at the Perelman School of Medicine at the University of Pennsylvania, also located in Philadelphia. After the presentation, we will open the program for questions from participants. As you think of questions for our speakers, please enter those questions into the chat on your screen during the program. And now it's my pleasure to turn the presentation over to Dr. Taylor. Welcome, Dr. Taylor.
Thank you, Stephanie. Thank you, everyone, for joining tonight. It's a real honor to be here with you. Really, I have 15 minutes to cover a very broad topic, but I think the biggest thing I would say to you is that jaw surgery has undergone some of the most important innovations and advances that I've seen in my career. Let's talk about why one might consider jaw surgery first. Jaw surgery corrects the position of the teeth beyond that which can be done with orthodontics. And its functional benefits are to improve chewing, biting, and speech. It can also, though, improve the health of the jaws, the teeth, and the jaw joints. And these pictures above show some pictures of teeth that are in malalignment that have been corrected through jaw surgery and orthodontics to the pictures below, from sometimes overbites or underbites. And I'll show examples of each of these as we go through the slides tonight. The other reason to consider jaw surgery is that it's one of our most powerful tools in surgery to change appearance, not just the way you see yourself, but how others may view you. And to that point, we actually did a study recently where we tried to measure the perceived effect of on personality traits and emotions that orthognathic or jaw surgery have by hiring a number of different workers on Amazon's MTurk online platform. We paid respondents to judge essentially on a Likert scale personality traits and emotions of patients who had undergone jaw surgery, but we did not tell them that these were in fact patients or that they had undergone jaw surgery. But it was very interesting when you looked at compared preoperative to postoperative photographs of patients in repose. Patients looked more dominant, more trustworthy, less threatening, more friendly, more intelligent, and more attractive. And as far as emotions, they look less angry, less scared, more happy, less sad, less afraid, and less disgusted. And again, these were people who were in repose, I might remind you. And these character traits and personality traits and emotional traits were highly conserved between different sociodemographic groups, which tells us that this effect that jaw surgery has seems to be quite pervasive. But jaw surgery really is a process, and it's important to understand that the treatment timeline takes really just about 2 years to go through. It starts with orthodontics, and orthodontics really can take a full year before you can go through the surgical phase of jaw surgery. Postoperatively, you can move teeth quite quickly in the 6 to 8 weeks following surgery, but orthodontics following jaw surgery can also take up to a year, meaning the entire treatment sequence of jaw surgery can take up to 2 years. But let's look at some effects of jaw surgery and specific patient examples. In this first patient example is a patient who has cleft lip and palate. And here he is before surgery. He's 18 years old, so he's done growing. And that's another important thing about jaw surgery is it's important to complete growth before going through jaw surgery so that it doesn't have to be done more than once in life. But you can see this young man has a severe underbite. His lower jaw has outpaced the growth of the upper jaw by a significant amount, making it difficult for him to breathe through his nose, chew food, and giving his face a very flat facial appearance, which to some made him appear angry when he was simply at rest. You can see here we're measuring the difference between the upper and lower jaw, and you can see his jaw discrepancy is about 12 millimeters. So as I mentioned before, jaw surgery has undergone tremendous technological advance, and the biggest advance is in the development and widespread availability of computer-aided design and modeling, which allows us to use pre-printed software, which shows us how we want to move the jaws with jaw surgery. I'm going to go back a slide. You can see here we are preoperatively, and here we've moved the jaws into proper alignment by advancing the upper jaw forwards, tilting the occlusal plane a bit, and then moving the lower jaw backwards. We can also add techniques such as fat grafting to our bony movements to improve the effects of surgery. And so here this young man is after undergoing jaw surgery. This is about 6 months after surgery, and you can see here he is about a year after surgery, having had his braces removed with perfect occlusion. But I want to show you some effects comparing the pre to the post-operative side by side. So here he is on the left before surgery and on the right after surgery. And just notice how jaw surgery is able to bring the various components of the face, forehead, nose, upper and lower lip, and chin into greater harmony. Jaw surgery is also ideal for patients who have significant craniofacial asymmetry. And this is a 19-year-old male who has what we call left condylar hypertrophy. But you can think about this as overgrowth of the lower jaw on the left. And you can see what that does is it pushes the chin point over to the right and gives him what's called lip incompetence. Lip incompetence is when it's hard to close your lips because the jaws are in such malalignment. And here he is smiling. You can see it's very difficult for him to really contain the lips together and hold the smiling pose. And you can see the significant underbite and dental asymmetry that he has in these preoperative dental views. So again, using CAD/CAM planning, we're able to take his preoperative CT scan and move the jaws into a more symmetric position, bringing the jaws into alignment by advancing the upper jaw, retruding the lower jaw, and then advancing the right side and retruding the left side to bring his jaw into symmetry. And here he is about a year after surgery. And again, I think the most impressive photographs are when you can compare the preoperative to the postoperative side by side. So here's the preoperative on the left, the postoperative on the right. And look how we've, again, brought the lips, the chin, the nasal position changes significantly as well. And you can see we've brought the teeth into better position. Now, sometimes we treat patients who have craniofacial syndromes, and I'll just show the effects of jaw surgery in two specific syndromes. And this first one is in a young woman who has Pierre-Robin sequence. So she was born with cleft palate and a very small lower jaw that made breathing difficult when she was a young girl. And so we used jaw surgery to close her anterior open by rotating the face, also giving her a much improved airway so that she can breathe better. She was on CPAP before surgery. Here are photos of her before, again, surgery on the left and after surgery on the right. Notice the mentalis strain that you can see in the chin on the left has been resolved by bringing the jaws and rotating the jaws forward. Interestingly, she was also able to get off of her CPAP. And here you can see bringing the teeth into position. One last patient with a craniofacial syndrome. This is a 16-year-old with Treacher-Collins syndrome. Treacher-Collins syndrome, as many of you may know, is often inherited from our parents. And she received the treacle gene from her mother. And she grows up, and again, someone who has a fairly diminutive chin, and you can see a little bit difficulty in hearing. She wears a hearing aid and then has some difficulty with breathing. You can see this is her preoperative occlusal views that you can see here. And again, the preoperative orthodontic phase takes about a year to complete. And then we're able to rotate and advance the face in order to improve the airway, as well as improve the appearance of the lower third of the face. Just like we did in the patient with fat grafting, we can augment the cheek area in patients with Treacher-Collins syndrome when we do jaw surgery. And again, here, I think the most impressive views are when you can view the preoperative and the postoperative together. Here she is 2 years after surgery. And then if you look at the preoperative to postoperative photos on the upper panel, but then look at the airway stripe in the lower panel from the pre to the post-op, you see the tremendous volumetric increase in airway stripe that helps her breathe better after surgery. Now listen, every surgery has risks and benefits, and the potential risks and complications of jaw surgery are significant. It's important to have a really honest conversation with your surgeon about what the risks of surgery are, including bleeding, infection, scarring, malalignment of the bone after surgery, cutting of the different nerves that provide sensation, as well as movement to the face, and injury to the teeth. These can be both temporary and long-lasting. Especially in patients with cleft lip and palate, there can be impacts on speech that, again, can be temporary or long-lasting. And there are some real short-term potential postoperative impacts that usually resolve in the weeks following surgery. I want to just leave you with one other piece of information, and that's that MyFace has a wonderful surgical simulator called the Craniofacial Interactive Virtual Assistant, or CIVA for short, that can show you the surgical maneuvers involved in the upper and lower jaw surgeries. The upper jaw, of course, called the Lefort 1, and the lower jaw called the bilateral sagittal split osteotomy, or BSSO for short. So those are some of my remarks that I have about jaw surgery. It really is a very, very powerful tool to affect both functionality and appearance of the face. Going through jaw surgery is a process, though, and the process for most patients can take up to 2 years. So it's not something where you can decide to have jaw surgery and you're done the day after you decide. It is a process, and each patient is different. And it's important to have a thorough discussion with your surgeon about the risks and benefits of surgery before undergoing the process that is jaw surgery. So with that, I'd like to conclude my remarks and turn things over to my colleague and good friend, Leanne McGee, to talk a little bit about the psychosocial impacts of jaw surgery. Leanne, take it away.
Thanks, Dr. Taylor. So as the psychologist in the cleft and craniofacial team here at CHOP, one of my jobs is to help our patients throughout the whole course of their care. And today I'm going to talk to you a little bit about the role I play in helping our families as they're making decisions to have surgery, coping with their pre-surgical orthodontic care and anxieties they might have, and then going through surgery, dealing with pain, swelling, recovery, changes in appearance. We'll talk a little bit about how we can use some different strategies to cope. One of the most important first steps is really just figuring out if and when orthognathic surgery is right for you. Dr. Taylor mentioned how the treatment timeline is like a 2-year span, but for most of our families, this conversation happens for years before they're actually ready for surgery. So you're likely meeting with your team on regular intervals and talking with your surgeon, your orthodontist, your speech pathologist, your ear, nose, and throat specialist about the pros and cons of an orthognathic surgery procedure for you. A lot of our patients at the time that they're teenagers are kind of burned out of surgical care. And so it can be really easy to say no to something that's long and uncomfortable and painful. But I really encourage our teens and their parents to take some time to walk through and to really understand the finer points of surgery. While there's certainly no such thing as a risk-free surgery, there are a lot of great benefits of orthognathic surgery. And for some families, those benefits might be realized sooner, and for others, they might be later. If you're an elite athlete, you've got a really competitive season coming up, that's probably not the time to have surgery. So you might think about surgery now, surgery later, surgery never. And I encourage my families to fill out a decision-making matrix like the one here, where everyone, parents, teens, siblings, get to talk about the pros, the cons, and the questions they have. And this is a great thing to bring with you to your doctor's visits so that you can make sure that you get the information you need to make the decision that's going to feel best for you. Once we make a decision for surgery, I like to make sure our patients feel really educated about what's going to happen. Dr. Taylor talked a little bit about that 2-year timeline in terms of orthodontics and surgery, and there's a lot of little steps along the way. And it can help to know that there are likely, over those 2 years, going to be some frequent visits to your orthodontist and to your surgeon. We like to make sure that the family is aware of the commitment that this might present for them, and so that they're timing their surgery at a phase of life that feels favorable for them. Most teenagers are really busy with school, sports, social lives, and so we want to kind of scale back and think about when it's going to make the most sense for me to be able to do this. We often prep families a lot for the surgery day, but I think the part that's often hardest is once you get home. And so one of my jobs is to help our patients really cope with what's it going to be like during their hospitalization and once they're recovering home, because that can be a few-week process before you're feeling like yourself again. Some of the things that I like to make sure my patients and their families really understand is all the ins and outs of their treatment and recovery. And when you have a great team, likely they are taking the time to teach you that over the course of months and years. Most of the teen patients I work with who have done jaw surgery tell me it's the worst thing and the best thing that they have ever had in terms of their surgical care. I really encourage you to talk with other patients, with your providers about kind of what that's going to look like for you so that you can understand how it can be both good and bad at the same time. I like to make sure that all of our patients know what the benefits are, what things are going to be needed before and after, what their hospital course might look like, how long they'll be recovering at home, what their pain management plan is going to be, what kind of dietary restrictions they might have after surgery, when they can get back to their regular activities, and what are some risks to be aware of. And so we'll zoom in a minute on just a couple of these features that I think are really important to understand. Planning for recovery is key. As I mentioned, this timeline can be really tricky for many of our families, and we want to do this at a time that you have the luxury of space and time to give yourself a chance to rest. Most of our patients, when they come for jaw surgery, they're here at the hospital for a couple of days. It can be 2 days, it could be 4 days, depends on how things are going for you. Most of our kiddos, once they go home, are resting at home for about 1 to 2 weeks. So you're counting on at least probably 2 weeks out of school and just kind of chilling out, laying around the house, and a lot of resting. You can be really sleepy after surgery, especially in the first week or so. And so you're not going to want to be planning to do very much at all. In addition to the physical recovery, most of our patients are on a soft diet for about 4 to 6 weeks, sometimes a little shorter, sometimes a little longer, depending on how they're tolerating things and chewing. Often with the jaw surgery, there are incisions in the mouth that take time to heal. You might have some heavy rubber bands that can make it hard to open your mouth all the way to do your regular eating. And so while your mouth is healing, a lot of our patients are on liquid and then puree and then soft solid foods for a couple of weeks. So it can take a lot of planning to make sure that you're meeting your nutritional needs. Activity is another thing that we have to consider. After you've done all of this important high-tech surgical work with your doctor and your orthodontist, we want to make sure that it stays where we want it to be, which means even when you're feeling better, for about 4 to 6 weeks, we don't have our patients do any kind of intense exercise or contact sports. We don't want to risk injury to that newly healed bone. And so those are all important things that I like to make sure our patients think about and plan for. What's your plan for where are you going to recover? Is there a comfortable room or place in your house? Are there kind of comfort items that you're going to want handy? Sometimes it's a nice time to think about getting like that extra long charger for your electronic devices, making sure you have all your favorite flavors of ice cream and yogurt, and thinking about who's going to come hang out with you and spend time with you when maybe you're swollen and you're grumpy and you're tired. So planning for recovery is really, I think, a key to success. We have to get through it no matter what. It's hard no matter what, but we can certainly smooth that path when we have a good plan. I really encourage my families during those first 2 weeks or so after surgery to think about a recovery routine that helps them ease back into some kind of normal activities. I encourage them to think about breaking up their day. Sometimes we say take it a day at a time. After jaw surgery, a day can feel really long. And so we might just take it the morning at a time, the afternoon at a time, and then the evening. And I encourage folks to think about a work, rest, and play activity that they might do in each of those chunks of time. Work could be self-care, like taking a shower. It might be doing your summer reading, cleaning your room, so some light activity. Rest is truly restful, not a lot of activity, not a lot of talking. Maybe it's a nap, but maybe it's just kind of chilling out and watching TV. And then play is something that has like the potential to be enjoyable. Maybe you're going to take a gentle walk with your family. You're going to play a game, watch a movie, something that's going to give you a chance to start to feel like yourself again. One of the trickiest challenges I think our patients face is coping with their diet after surgery. As I mentioned, most folks are on soft food for at least a month after surgery. And so it can be tough to keep up with. People get bored with eating mushy foods. The flavors aren't super exciting. And it can be just really frustrating to be squirting small amounts of food. I had one young adult patient. He was a varsity athlete. He had a lot of high nutrition needs and wanted to make sure that he wasn't going to be losing any muscle mass after surgery when he was in his downtime. And he came up with this, I think, really inventive solution. He used those condiment bottles so that he could get larger volumes of food in his mouth when he couldn't open it all the way. He was tired of doing little baby spoons of food. And so that was one tip that I got from a patient that's been handy for other families. Talk with your nursing team. We want to make sure that you have the resources you need so that you can plan for really high nutrient dense food, a variety of flavors, so that you're getting good nutrition. Some people will lose some weight after surgery, and most of the time that comes back once you're back to your regular diet. And one thing socially and emotionally that can be helpful is to try to maintain some regular meal times and share meals socially with friends and family. Maybe everyone's having soup or scrambled eggs, but it can feel a little less isolating when you can share that with others. Pain, I think, is the other big challenge that our families and patients face. When you're at the hospital, your pain is definitely managed through your nursing team. There's often local numbing injections that you get at the surgical site and medications that you get through your IV or by mouth. But at home, it can be a little bit trickier for our patients to manage their pain. The goal is not to be pain-free, but to be comfortable enough to like take a nap or watch a show. Your team will talk with you about the pain medication regimen that's going to be best for you. Many of our patients might take a narcotic or opioid pain medicine for the first few days after surgery, and then step down to something like Tylenol or ibuprofen with rest and ice. There are lots of non-medication pain management strategies that we can add to help you stay comfortable. I encourage folks to think about distraction and relaxation and other sensory strategies. Ice, rest, and gentle activity can be really helpful. And then thinking about maybe taking a walk. If things are feeling uncomfortable laying around in bed, go change your scenery and see if that gives you a little bit of relief or distraction. It's very normal to be anxious before, during, and after surgery. And so sometimes people tell me they're scared of feeling scared, or what if I'm anxious? And my advice is to plan for it. Let's anticipate anxiety. We know that at some point through this process, you or your parents are going to feel really worried about what's going to happen. I like folks to remember all the really careful years and months of thought and planning that got you to this point, that you and your team think that you're ready and that you've got the tools and support to get through this. And so I encourage you to ride that wave of anxiety. It's okay if you feel bad for a little bit, and know that feeling better is around the corner. Things that can help us feel better when we're super stressed out is to try our best to get sleep, and engage in some relaxing activities, things that can distract us or remind us of kind of like our regular self and not our medical patient recovering at home self. And then really making sure that we're seeking support. It might be from your family. Maybe you'll have a close friend or two who's fun to come visit with, or maybe you're going to connect with other patients who have done this before and can kind of coach you through it with their own experiences. And as Dr. Taylor talked about, one of the big changes, we talked about the functional changes, but one of the big ones is coping with appearance. Our appearance changes really drastically with jaw surgery. And that can be tough for folks to adjust to. A lot of people have heard the term body image. Body image is sort of how you feel about how you look, how you actually look, how other people think you look, what kinds of experiences you've had about related to your appearance. And so for a lot of our kids with cleft and craniofacial conditions, appearance has been something on their mind for a long time. But it rarely changes so quickly as it does after a surgery. Excuse me. So very often, in addition to having those amazing changes in the alignment of your jaw, you're also likely going to be experiencing some post-op short-term changes in appearance that are swelling, bruising, numbness, things that just kind of feel and look not great in those first couple of days and week or so after surgery. And so our body image is having to adjust over time. And very often how we feel about how we look doesn't match on to how we actually look. So you might have someone say, "Oh my, you look great." And you can say, "Really? I feel terrible." And so it can take time. And sometimes it's a couple of days and people feel like they look great. And sometimes it can be longer to adjust to that. You can talk with your team about the degree of change that you can anticipate. That computer modeling and simulation that your team does can sometimes give you a sense of the degree of change. You can look at photos of other folks who have had surgery before and after. But the biggest thing is to just give yourself the space and time to heal and adapt, and know that physical healing and emotional healing are not always at the same pace. So we thought, how better to kind of share with folks the experience of getting through jaw surgery than to talk with a patient, a teenage patient, and his family about their experiences coping. And so I would like to introduce everybody to a family who has been through orthognathic surgery in the past few years with one of their children, and they're actually about to walk down that road again with another. Dan Featherstone is here with his mom, Peggy, and they're going to talk about their experiences from the patient and the parent perspective. So welcome to Dan and Peggy. We are so thankful to have you here joining us. I thought we could talk first a little bit with Peggy to get some parent perspectives, and we'll return to hear some tips from you later about what helps kids recover. But why don't you first tell us a little bit about your big family?
Well, thank you, Dr. McGee. My name is Peggy, and my husband, Mark, and I have been married for over 30 years. We have 4 biological children, Maggie, Thomas, Mark, and John. And we always wanted a large family, and adoption was a wonderful way for us to accomplish this dream. When my son John was 13 months old, my husband and I went to China and we adopted Anna, who was 16 months. And in the adoption community, they say that one adopted child brings home another, and that was true for us. So 2 years later, we went back to China and we adopted Danny, and he was 2 years old. Danny would be the first of our four other children from China that have bilateral cleft palate and cleft lip. 2 years later, we adopted Carrie Ann, and she was 3.5 years old when she came home. So we had 7 children under the age of 10, and it was a full, glorious family. But deep down, I knew in my heart, and my husband, well, I knew in my heart, my husband didn't quite realize it just yet, that we had room for more. So 7 years later, we went back, and Andrew and then Emma arrived, and they were both 10 years old when they came home. And our family was complete, and our hearts were full. So
That's awesome.
The tricky math here is that it's now quite a few years later, and our oldest is 27 and our youngest is 16. And that's all of us on the screen there. That's Dan's graduation from high school.
Thanks so much, Peggy. So you have been through this cleft journey not once, but 4 times with your kids. Can you tell us a little bit about what Dan's early years of cleft care looked like?
Well, when Dan came home, he was 2, and his lip was repaired in China, but his palate was not yet surgically closed. So about 2 weeks after we came home, we had our first appointment with Dr. Lowe and the cleft team. And shortly thereafter, Dan had his palate closed, some ear tubes, and he had a revision of his lip scar. And at that point, I knew that we were on quite a long journey, but I knew from the bottom of my heart that we were in the best of hands. So then the next few years, Dan had some ear tubes, some speech therapy, and multiple devices to get him ready for his bone graft. So at 7, he had his bone graft. And then when he was about 10, they began his orthodontic treatment with Dr. Na, who is the orthodontist with the team at CHOP. So multiple expanders and devices for years, meticulous care and sequential planning for the final surgery over the next 7 years. And we would see Dr. Na about every 6 weeks. And as you know, we saw you all through Dan's time since he came home. We would see you yearly, and then we would see Dr. Taylor as well as we were getting ready for the jaw surgery. And then when Dan was 17, he had his jaw surgery. And a year after he had after that was all settled, then he had his nose surgery, his final nose surgery. So it's been quite the journey, and I've done it 4 times, but I'm not done yet.
Well, thanks so much, Peggy. I'm sure some of the parents who are on are going to have some great questions for you at the end. Now I'd like to turn things over to Dan Featherstone, who is a patient I've been excited to get to know and see grow up over the years. Dan's going to tell us a little bit about his surgical experience, specifically with jaw surgery. So take it away, Dan.
Hey everyone, I'm Dan Featherstone, as I was introduced. It's nice to be here. Thank you for having me. And I'm here to talk about my experience with surgeries. First, when and why did I decide to have jaw surgery? So it was first introduced to me early in my journey, probably like 10 years old. There was like a general overview of like what surgeries I would have and like when they would happen. It was a general plan, but it would become more specific as I became older. I was deciding on when to actually have the surgery, they planned around once I was done growing, so I was around 18 years old. And my actual like mindset and like thought process of having it was basically how I would look after. That was the main goal for me, personally. Like how would before the surgery I had a large underbite, and my face was kind of flat. So like afterward my jaw would be moved back and my upper jaw would be moved forward, so I'd have a more even looking face. But I was still worried about that. But I've known this team for so long that I trusted their judgment and how they would go through with the procedure, so I accepted and decided to have it. Orthodontically, obviously my underbite would be fixed, which would be fixing my speech, my eating, chewing, stuff like that. So that would definitely help me there. And I was just mostly focusing on how I appear.
Thanks, Dan. So it sounds like there were functional and appearance concerns that you had that kind of led you to decide that jaw surgery was right for you. Can you tell us a little bit about what your recovery was like after surgery?
So yeah, so the first few days of recovery, I was in the hospital for the first night. So then I was attached to a bunch of tubes. I was still pretty sore and tired from the surgery, so I couldn't go anywhere without help, and my mouth was still like rubber band shut, so eating was like not possible yet. But after the first night, I was able to go home. So I was able to go home, and that's when I started my liquid diet. The liquid diet wasn't super fun, I'm not gonna lie, but it was easier. You know, I had like milkshakes and protein shakes, so I kept up like nutritional and just to fill me up. So that was the first few days, but after like the fourth day, I was able to like walk around comfortably without like, because you are weak after, but I was able to comfortably walk around after that, and then I was able to like function normally, you know, walk outside, stuff like that, and
So the first few days sound really rough. What would you say were like the low point and the high point for you through this whole long recovery process? And tell us a little bit about how your surgery maybe changed you in those weeks and months.
so the lowest point probably of recovery was like the first few days. I was so tired of eating the like soft foods and being so like weak from the surgery. I was just like so done with it, but you can't have the low points without the high points. And I think my high point, it's strange, but it was about, I would say, 7 months after surgery. I was still kind of numb from all the surgery. I didn't have full like muscle function in my face yet, but this one time when I was taking a picture, I smiled and I could see my top teeth, which I could never do. I passed like 18 years. I've never been able to see my top teeth without like having to lift it. And I don't know why, but that like lightened me up. Like I was just like, that's so cool. I can see my top teeth. It seems so small to like anyone else, but to me, it was just like a big like change. I was like, oh, this worked. Like I look better, and that was definitely the high point for me. And another one, I'll say this one. I hadn't really been convinced that I was looking super better after my surgery, but one of my parents' friends talked to my mom. He was like, "Danny looks great. His face looks so much better. He looks so much fuller." And I've been hearing my mom say this for months and weeks after the surgery, but I wasn't fully convinced. You know, because your mom, she supports you. But when that friend's parent said that, it just connected with me. I was like, maybe I'm wrong. Maybe I do look good. Maybe like everything she said wasn't, you know, just trying to cheer me up. So that was another great high point throughout the experience.
How do you think, besides the physical changes, or maybe with the physical changes, what do you feel has changed for you from before to after your jaw surgery?
So before my jaw surgery, I wasn't like super expressive of how I felt about my face and how I thought other people felt about my face. But I feel like after, I was really forced to base my feelings about how I looked and how I think other people saw how I looked, and that just really it forced me to confront those feelings and work them out.
So I think experience is a great teacher. And one of the things that we really like to do in our team is to make sure that our families connect, just like here at My Face, we're getting to share your experience with other potential orthognathic surgery patients. Any like tips or words of wisdom or things that you think patients should know if they are making a decision or they're getting ready to go through jaw surgery?
Yeah, I have one thing. I totally agree with the quote that you said earlier. This is the best and the worst surgery I've ever had. It is so grueling sometimes during recovery, and sometimes you'll feel terrible, but it is the best feeling when you come out. About 3 years after surgery right now, I feel so much better about my face and how I look and how I feel in general. So no matter what you think the first week, first 6 months, maybe even a year in, it was worth it. Despite what you might think in those small moments where you doubt yourself, it was absolutely worth it. Especially talking with a psychologist like you, helping me work through how I felt and how I thought other people looked at me. It was absolutely worth it.
Thanks so much, Dan. Can you tell us a little bit about kind of what you're up to now? So you're sort of at the end of your cleft care journey in a lot of ways in terms of your surgical and your orthodontic stuff. I know the braces are gone. We still keep tabs on you through your family. But tell us a little bit about kind of where you are these days.
Yeah, so now I used to go to CHOP every 6 weeks before my surgery, but now I don't. I won't be seeing them for quite a while actually. And I don't have any braces or retainers like you said. And now I have like a temporary one that I can take out when I need to eat or anything else like that. But it's odd, but it's good. It feels good to be done with the journey. I appreciate everything that everyone has done for me in the past, especially you, Dr. Taylor, my other surgeons and orthodontists. But it feels nice to be done. And now, since I'm done, I still have 3 younger siblings on the way, so it feels good that I can use my knowledge and my experience to help them. Like my younger brother Andrew will be doing his fourth surgery this coming year, so I'm ready to help him out when he needs it.
Well, he'll be lucky to have you as a guide. And so we thank you guys for sharing your experience. And Peggy, I was hoping you could tell us a little bit from the parent perspective. Were there any like little gems that you learned as a parent that you think helped smooth that post-op period for Dan and for the family that you could share with everybody tonight?
Well, Leanne, I have a few of them. One is we used when Dan came home. We used a recliner chair for quite some time. He was comfortable in it. They're fluffy and they're big, and I think that it helped with the swelling, and it also helped with his breathing because that was a big thing. He felt like his nose was stuffed up and he couldn't breathe. And they tend to drool. And if you're sitting upright, that drooling is just a little bit easier to tolerate and grasp. Keep on top of those pain meds. Be proactive, especially the Tylenol and the ibuprofen. Keep it going. Lots of ice and lots of ice. And even if you're right in front of them, all of their communication is done through a text. They don't want to talk. They can't talk, and they don't need to. Some of the things that we did for Dan was lots of fast food shakes and macaroni and cheese and mashed potatoes, water ice from all of his favorite spots that he's had and that we know. So I would have the other kids go and get those treats for him, because I don't think that your family members, especially my other children, they were not expecting him to be as swollen and as uncomfortable as he was. And they wanted to do something. And there's not a whole lot they can do, but if they can run out and have Dan text them what their order is for the shakes or the mashed potatoes at his favorite fast food place, that is something that they're doing. And it's something that I think Dan appreciated, but they can also sit and eat with him. because they feel isolated and alone sometimes. So to have that connection with food is good, because food is a big challenge. So if a family member can help with that, that's great. Take a walk outside day 1 or 2. That fresh air is great for them. And we have received this great pamphlet from you, Dr. McGee, that goes over a lot of things that will help the family to prep the family and also the patients. And the final thing that I just want to say is they're teenagers, so they are not used to needing their family, and especially their mothers. And they need you more than you realize and more than they realize. And it's not just that initial post-op. It goes on for 6 weeks and 2 months and 3 months and a year out. And you have to be ready for it, and be attentive to it. And so that's what I would recommend. Just be there. Just be there.
Well, thanks, Peggy and Dan, so much for sharing your experiences. It's a real gift that you're giving to the patient community. And now we're going to turn it over to Stephanie to see if there's anything else that they might be able to learn from you or from me or Dr. Taylor.
Oh, well, thank you. I have to say thank you, Dr. Taylor, Dr. McGee, Dan, and Peggy. Oh my God, what an incredible story, and what a model of what a comprehensive craniofacial care team looks like. Thank you. Congratulations to CHOP for everything that you're doing. So we'd like to take some questions. So if you do have questions, please put them in the chat. And for everybody to benefit, we want to make sure that those questions are general in nature, and then our guests can answer those questions in a general nature. So let's get started. The first question that we have is, my 15-year-old daughter is a competitive athlete who plays soccer and other sports at a very high level. She may wish to continue playing soccer when she goes off to college. If she undergoes jaw surgery, what is a realistic recovery time for returning to the sports afterwards? And would returning to competitive sports be a real option after undergoing this type of surgery? Dr. Taylor?
It's a great question, and my general principle is to give kids about a 6 weeks period during which their bones are healing off of sports. Not only do I absolutely adore competitive athletics, having been a previous competitive athlete myself, but I think it's so important to healing sometimes to get back to the things we love. So not only can you play competitive sports, but I in fact recommend it. My sense is that people who take care of their bodies, such as athletes, probably heal better from bony surgery. And that I think is also true of jaw surgery. The last thing I'll say is that certain types of jaw surgery, and again, not all types, but certain types of jaw surgery can improve the airway, as I hope I mentioned with the Treacher Collins examples, which may in fact enhance athletic performance.
Great. Thank you, Dr. Taylor. I do want to say we have a comment from Dade County, Florida. We're very excited. They're giving kudos to MyFace for the support that we've given to their patients down in Florida. We're so delighted to have people from all over the country joining us today. So thank you for that comment. So I have a question for you, Peggy. As a parent, what was the hardest part for you watching Dan go through these surgeries?
I would say the initial sadness of when he came home. He was exhausted. He was in pain. He couldn't do the things that he really enjoyed. And that was initially, and then later on, I think it was difficult for Dan to kind of get used to his new face. And thank God for Dr. McGee and Dr. Taylor and the whole team, because that's how it works at CHOP. They know him since he was 2, and so it's no surprise when he's 18 and finishing the treatment plan. We knew that we could go to them and help him with the adjustment of his new appearance. So that for me was the hardest. And I mentioned in the parent tips that you really need to kind of keep your eyes and ears open later on, not just that first week. You really need to kind of keep an eye on them for quite some time because they need you. They need you.
Well, you and your husband have been incredible, and it's just amazing what you've done with your family. We do have a question. How soon can a patient get back to speaking normally after surgery?
I can try to answer that. I think, again, not all job movements are the same, but in general, we have our patients in some form of rubber bands after surgery. The rubber bands serve a couple of purposes, but one important purpose is to just provide some support to the lower jaw in the early healing phase. I think it decreases pain. You can speak even with rubber bands on. The purpose of the rubber bands is to keep the jaws somewhat coordinated, but you can speak. I would say, though, most families, and I would love maybe to get Dan's perspective on this, but most kids, it's probably 7 to 10 days before they're getting back to really moving their mouth in a way where speech is really intelligible and easy for their family to understand. But Dan, I'd love your perspective on that.
Yeah, I can chip in on that. Yeah, for the first few days, obviously, I can't really move my mouth, so yeah, I won't be able to speak. But I would say I had like a few tics, like I couldn't pronounce my S's correctly, and my D's were kind of weak. But that went away within I would say like easily the first month or two, because your muscles are just like getting back used to like after traumatic surgery. They just need to get back moving, I guess.
Great. Thanks, Dan. Here's another question for you, Dan. How long would you say that it took you to adjust to the to changes in your facial appearance following surgery? Did you experience moments of doubt or disappointment with the changes? And just wondering what this might be like for when it's this person's turn to have the surgery.
Yeah, I would say fully accepting my face. It wasn't like a linear journey for that. I think like now I would say I'm done it, but it took a good like 1-2 years to be like fully accepting of what I looked like and like how I looked to other people. Because yeah, it wasn't a linear track. I would say there was definitely some highs and lows, but I can say after 1 or 2 years you're used to it.
No, that's helpful. That's really honest. So thanks for sharing that, Dan. A question for Dr. McGee. My child with cleft lip and palate has rather low self-esteem due to comments from others about her appearance. Do you find that many teenagers experience a boost in self-confidence after undergoing the surgery?
Yeah, so I think Dan hit the nail on the head. Yes, and it's often not a linear process. So I think for a lot of folks who experience ongoing negative experiences socially because of their appearance, they can internalize a lot of those beliefs about not feeling or looking attractive to others. So not only are they combating negative comments from others, but sometimes that affects how they view themselves. And so that's often work that gets done kind of in parallel. I love getting to work with our patients before, during, and after surgery to help acknowledge sometimes what those experiences have been, how it's affected them, and how we can, in addition to the surgical changes, work on building some psychological resiliency that really builds their confidence and their acceptance and embracing who they are, their cleft and their craniofacial condition in all stages of care, before, during, and after surgery. So it's an ongoing process that I think, like Dan said, can sometimes be years, even when their facial appearance might change overnight.
Thank you, Dr. McGee. We have time for one more question for Dr. Taylor. My child will soon be 18 years old, and her medical team has spoken to her about the possibility of jaw surgery. However, she's not ready to undergo surgery, at least at the current time. Are there any disadvantages to waiting a few years and possibly having it done later if she feels ready to go through with it then?
Yeah, I don't think there are any major downsides to waiting, let's say, 5 or 10 years. As we get older, which is bad news for me, as we get older, our bodies don't heal quite as easily as they do when we're younger. But I think waiting a few years and being really ready to go through this outweighs the negative or the downside to potentially waiting. I think Dan's comments really, again, resonate with me. Going through jaw surgery is tough, and doing so if you're not totally convinced that it's the right thing for you might make that challenge almost hard to surmount. So I think being psychologically ready is one of the most important things. And I guess it's one of the reasons I feel so lucky to work with Dr. McGee, because she, I think, helps us think and get outside of ourselves as surgeons about an individual's readiness for something of this magnitude.
Great, thank you. I'm going to grab one more question for you, Dr. Taylor. Are there any symptoms to look out for after the surgery?
So people are generally in the hospital 1 to 2 nights after the surgery, and if something really wrong is going to happen, it generally would happen in that period. But things we worry about in the short term, like symptoms, would be difficulty breathing, fever, things that would lead us to believe that an infection potentially was happening, or a feeling that the jawbones may not be aligned quite the way everyone had hoped, or maybe the way they were aligned just after coming out of the operating room. So those are a lot of the things that I'm looking for as I round on my patients after surgery here. Now after you go home, again, things in sort of the subacute phase, or as Dan has heard me call it, the tumbleweeds phase of things, because you're at home and you're alone. But some of the things that can happen, the most common thing would be some sort of problem with healing of the bones or infection. So those are all things that we would potentially say to someone, come back into the hospital, let's take a look at things, let's review everything together and make sure you're okay. Fortunately, jaw surgery tends to be, in the grand scheme of large complications, a relatively low-risk process. Which isn't to say it's not hard to go through.
Great. Thank you, Dr. Taylor. Well, I want to thank all of you, Dr. Taylor, Dr. McGee, Dan, Peggy, for being here tonight, sharing your stories. Just really important that you were here. We really appreciate it. And I want to thank everybody who joined us this evening for this web education program. I do apologize that we couldn't get to all of the questions this evening, but if you have an additional question, you can send it right to us at info@myface.org. Because craniofacial differences impact the body and spirit so significantly, MyFace provides important direct services such as access to patient and family support groups, all now virtual, topic-driven workshops, and online programs that serve to educate as well as entertain. These programs offer guidance, resources, and a supportive environment for all who participate. MyFace also hosts unique networking opportunities that seek to bring our community together to empower the spirit and build strength, and let families across the nation know that they are not alone. For more information about the programs and services we offer, please visit our website at myface.org. Also, please join us for the next webinar in our Transforming Lives webinar series titled Management of Hearing Loss Associated with Cleft Lip and Palate and Other Craniofacial Conditions, coming this fall. Further information will be available on the myface.org website soon. Next week, we'll be hosting the next My Face, My Story podcast episode titled Advocating for Your Child, A Parent's Perspective. That will be held on Wednesday, July 20th at 6 p.m. Eastern Time. To register, visit myface.org/mystory. And also, please join us in New York City on Sunday, September 18th for our annual Races for Faces event. For further information and registration, please visit racesforfaces.org. At MyFace, we strive to provide the most helpful and informative resources. To help us do so, we ask that you take a few moments to complete our brief survey by visiting myface.org/jaw surgery and let us know your thoughts. We have also provided this information in the reminder we will send you an email after this program. Again, thank you so much for sharing your time with us today, and have a wonderful evening.